Good afternoon, everyone. We're going to be getting started in just a few moments. This is Shiloh Jones from the Business Group. All right, good afternoon, everyone, and welcome to today's webinar, Losing Sleep Over Chronic Conditions, How One Company is Putting Their Concerns to Rest. My name is Shiloh Jones, and I'm an analyst on the National Business Group on Healthcare Cost and Delivery team, and I'm happy to facilitate today's event. First, I'd like to go over some logistic items. So the slides and recording from today's webinar will be available on the NBGH website. So if you go to our main webpage and click on Events, and then Webinars, you'll see the link there. Please note that while all attendees' lines are muted, you can ask questions to our presenters at any time by clicking the Q&A tab in the toolbar, typing your question, and clicking Send. We've left time after today's presentation to go through these questions, and if there are any that we aren't able to get to, we'll be sure to follow up via email. And with that, just getting into what we're going to talk about during today's webinar. We're going to learn a little bit more about how Southern Company implemented Sleep Charge to treat sleep as a priority rather than a luxury. Also about how they drove engagement through the program as a means of preventing a number of chronic medical conditions. And by addressing sleep, they are helping their employees get healthier and improve their long-term health while significantly reducing costs. So let's introduce today's speakers. Jonathan King is a senior consultant for Southern Company Benefits and focuses his efforts on healthcare financial planning, short and long-term healthcare strategy, and data analytics. Prior to working at Southern Company, Jonathan worked at Aon, where he acted as a benefits consultant, developing and executing health and welfare benefit strategies for employers, law firms, and hospitals. George Marling currently works at Southern Company Benefits as a senior consultant. George joined Southern Company in 2000 as a recruiter for Southern Company Generation and Alabama Power. In 2001, he assumed the role of HR business consultant for engineering and construction services. In 2005, he assumed the same role supporting competitive generation, Southern Power, and generation finance. Finally, John Letter served as president and chief operating officer of Fusion Health. John has 24 years of executive leadership experience in general management and sales operations, including managing customer teams and operating units within the Coca-Cola system. He's built a reputation for creating strategic alliances with organizations and customer leaders to effectively align with and support key business initiatives. He provides Fusion Health expertise in building operating units, sales processes, brand development, people development, and market expansion. And with that, I'll turn this over to you. Thank you so much.
Thanks, Shiloh, and good afternoon, everyone. Thank you for the opportunity to speak with you today on Southern Company and our sleep program initiatives. Before we get into the meat of the presentation, just want to give you a quick overview of who Southern Company is. We are a regulated energy and utility company that services both general electric utilities and natural gas. We have over 9 million customers spread throughout the United States. We focus on making, moving, and selling energy, both in a traditional sense of coal, nuclear, hydro, but also renewables in solar and wind as well. So we are a very large utility and look to make, move, and sell energy. That's kind of the background. We have about 30,000 plus employees across the United States. So we have a very diverse population in terms of demographics. We have over 4 generations in the workforce, and as well as varying levels of income. We have both regular union jobs and non-union jobs. So we have a very diverse demographic when we're looking through how to deliver benefits that provide value. So if you want to move to the next slide. So as we get into today's presentation, I will be walking you through a little bit of how Southern Company sets our healthcare strategy as a whole, and then use sleep as an example of how we deployed our strategy and looking at our national statistics, our data analytics that are company specific, and how we translate that into a business case. And then George is going to walk you through a little bit of the employee experience that after individuals stepped into our sleep management program, of what they experienced, how we communicate with them, how we position those communications, and how we support our employees through the process. And then John will go through a little bit of Fusion Health specifically as our business partner for our sleep health program, and talk through how they're supporting us in this fashion, a little more overview of their company, and how we proceed from there. So with that, we'll get into the meat. If you want to move to the next slide. So from a Southern Company perspective, this slide really represents how we outline our healthcare strategy as a whole. Our main objectives is really to see how we can drive value to both the company and the employees based on the intersection of quality and price. And those mean different things to different individuals, but we look at it in kind of 3 aspects of we want to provide to evaluate the marketplace and provide a robust choice of plans, tools, and resources. And we do our aim is to curate those throughout the marketplace and make sure that we're delivering tools that are based on meeting our employees where they are. And so that way they can use these resources. They're easy to understand. They're equipped with, when they set foot into the healthcare landscape, they know where to go, they know who to see, and they know what questions to ask. And so we look at it from that holistic perspective. And part of that, really, we use the data to help drive our decision-making process. So no decision is made without having really a business case and supporting information to design why we would make recommendations or make modifications to what we're offering or enhancements to provide value to both the company and employees. If you want to roll to the next slide. So with that, we'll talk a little bit about as we're deploying our healthcare strategy, we kind of have 3 pillars that we use in our evaluation process. So as I mentioned, we use key data metrics. So we have a data warehouse of all of our healthcare claims information. We use a lot of market data to compare ourselves against national averages, industry averages, and what's going on in the healthcare landscape, and really evaluate how do those compare and how can we impact our population specifically. In addition to that, we take our directives from leadership in terms of what are our business needs? Are we looking to bend the cost curve and reduce cost overall? Or are we looking to say, hey, this is a gap we've identified based on feedback from employees. So we need to look to have a more designed process around providing them the experience they need because it's confusing and cumbersome, or they're just not experts in this area. So we really look to provide, enhance the value through that experience while also looking to mitigate costs. But really, one of the biggest things that we focus on in determining business needs and value is how can we not just cost shift to employees, so transfer costs from the employer to the employee, but can we look for kind of those win-win situations where we can save the company money, we can reduce the pain points or the cost from the employee's perspective, and then also add that value as we go through that. And the sleep health program that we implemented really is going to be a testament to how we leveraged all three of these pieces to roll out a program that's significantly impacted our population. So we'll talk through some of the specifics. And attack.
Are we waiting for George?
No, I think we may have lost Jonathan. I don't know.
We'll try and get to Jonathan, see if he can reconnect.
Yep.
Yeah,
No problem. We'll get him back on the line.
Yeah, I think he's dialing back in right now.
Just give us one moment to get Jonathan back on the line. Hey, Jonathan, you there?
Yes, I'm back. Thank you.
All right. Sounds good.
All right, please forgive me. So the call dropped. So looking back through our data analytics, we look to tackle sleep on the basis of that it's relatable. I think if you go out and ask any of your employees if they had the best sleep they've ever had last night, I'd say the majority said no. So it's something we know that's not only impacting people who might have a medical condition, but it's impacting everyone on a certain level on a day-to-day basis. And so when we started looking through some of the national data, we see that sleep is very much intertwined with several conditions that are prevalent throughout the country. And you can see here that diabetes, hypertension, congestive heart failure, depression, anxiety, all things that are very prevalent throughout the workforce in the United States are impacted by either poor sleep or could be related to having a sleep disorder such as sleep apnea or insomnia. So what we did was we looked at this, and knowing that having such a large footprint that could be dealing with this, we have union workers who work 10-hour shifts, some work 12-hour shifts, some guys work 8 days straight or 14 days straight during shutdown. So we know that they're impacted by that, and so we want to look to impact it. So the way we did that is, if you'll roll to the next slide, we started seeing, okay, we recognize at a more global level that a lot of these conditions are prevalent within our organization as well as nationally, and how is that related to our group? So we've listed here some of the top chronic conditions that are within the Southern Company population based on our data analytics. And you'll notice there's about 6 or so of our top 10 that could be impacted by poor sleep or have a related sleep disorder. So with these being not only high in prevalence but high in cost, we realize that taking over 60% of our top 10 and looking for a solution that could not only drive down the cost for these specific conditions, but also get our employees back to work and feeling better is something we need to move forward with. So not only looking at the healthcare data, we move to the next slide. You can see that we also kind of looked at our total overall healthcare costs, and we think about presenteeism and absenteeism, and this really shows that we know certain people have chronic conditions within our population, but we really try to look at our employees and rank them on kind of a risk level. What is the appetite of not only what are they going to cost us in the future, but how do we keep them well? How do we keep them from progressing into a state where they're not going to be the most productive in the office because they're having to deal with healthcare issues? But if we capture them before they get to a moderate risk or high risk state, we could be saving the company money. The average person in a high risk category is costing us 10 times more than if we're keeping someone well. So how do we help people keep from moving across this risk continuum and increasing our costs? But how do we keep them at work, productive, and there, and reducing our costs? Not only in the health claims perspective, but in being absent from work or being out from work. So those are the kind of the two main avenues that we look through when we're looking through our Southern Company specific data to be able to talk through why we would move forward with sleep health. So you want to move to the next slide. So some of the other things that come up during this evaluation process is there is an aspect of safety within our organization. So we have people climbing poles, stringing cable wires, handling natural gas meters. So it's very much a safety culture. And so part of that, we do have some fitness for duty testing, and part of that is individuals would be tested for conditions such as sleep apnea. And with that, if you are diagnosed, you have to show a level of adherence ongoing, and to be able to pass those tests, you have to, if you have that formal diagnosis or something comes up in your physical, you have to be able to get the diagnosis you need in order to get your licensing. And so as we are going through that process with our individuals, we realize it's taking a very long time to get diagnosis and treatment if necessary. And so I think part of that is an identifier for us in that we need to shorten the process time, that it was taking upwards of 6 months to a year for people to get care, to get back on the job and getting full force. And so then we look through our data some more, and we're, sleep in general is taking people often 10 years before they actually receive their diagnosis. But the main piece is, even if they were identified with having a sleep health condition, that 50% don't start treatment, and 50% of that 50% who do don't continue more for the year. So how do we keep people who we've identified who have a medical need, giving them the support that they need in order to sleep better and feel healthy? So it was taking 132 days on average to receive care. So we're really looking from a workflow perspective and a employee experience in navigating the healthcare landscape of compressing the time frame and making it easier to receive care. So that really led us to evaluate the marketplace of how we impact sleep, and we came across Fusion Health, and we were very impressed with not only their technology, but the support system that they provide once you get into the system. We got a lot of feedback that going in for a sleep test into a facility hooked up to a bunch of wires, you're going in to then to mine your sleep, and you're often not getting any sleep when you're in there. So we wanted to find a way to make that as comfortable as possible, and then also reduce the time frame between treatment or testing, diagnosis, and treatment. And John will go through Fusion's model, but we believe that it greatly compresses that time frame because you can be diagnosed within less than a week if you've identified that you might have a medical issue. Being able for our non-regulated groups to have the in-home test really allows the convenience factor to play to where you're not.
Jonathan, are you still on? We may have lost you again. All right, just give us one more moment and we'll get him back.
So it's a cost-effective delivery model as well. We've looked through what we were spending, and because Fusion uses a bundled solution payment, it was about a third of the cost overall from the traditional care model when you add in testing, diagnosis, and ongoing care. So their access to sleep coaches and following the care for the ongoing treatment that provides the support. We recognize that the first several weeks of getting adjusted to the sleep apnea treatment is very difficult, but they provide the support to walk you through that for our regulated population. They also allowed us to have that chain of custody where people are having certified adherence to where they continue to get their licensing. So we believe their model really allowed us to hit all of the pain points from reviewing our data to addressing a major need, but also from the end user experience, alleviated a lot of the pain points of the timeline and the ongoing treatment aspect. So we really believe that's how Fusion has helped us through that. So we'll walk through to the next slide. Once we implemented in late 2016. So we have a little bit of almost 2 years of results, and I think here we're showing about a 1-year result pass. You can see we compared the individuals who mapped over into the sleep charge program in comparison to those who still are using the traditional model specifically for sleep apnea, and the fact that they continue to get their testing and treatment separate. And on average, there is a 41% less expensive for those in the program versus not. We saw a dramatic impact, as we talked before, of the comorbid conditions related to sleep, such as diabetes and hypertension, CAD. And they're trending at over a 10% cheaper cost for those who have those conditions but are also in the program. So it's driving down our costs, not only related to sleep, but related to these other conditions. So if you'll roll to the next slide, another example of that is a little more specific. So 2 of our major drivers, as you recall, are diabetes and hypertension. So the sleep charge participants with diabetes, their cost on an annual basis dropped by 71%. You see something very similar with hypertension. So we know now through the data, not only through the experience that our people are sleeping better, that we're driving down the cost from a company perspective while getting people the care they need sooner. So we've seen a dramatic impact there. So with that, I'm going to turn it over to George Marling. He's going to walk through kind of some of the initial engagement, how we rolled out the program from an employee perspective, how it's communicated to leadership and employees, and then kind of the results post-impact.
All right, thanks, Jonathan. I appreciate it. Yeah, so when we think about the participant experience, I'll take a deeper dive into what did we do pre-launch, what did we do during launch, and then what are we doing to kind of keep things going? Because we didn't want to just make one big splash. We want this to be an ongoing process. So looking at the slide that we have here, prior to launch, and everyone probably is appreciative of this, we needed to get leadership buy-in. It was really important that in order to be successful, to have successful engagement, that we get the right leadership buy-in, that we then socialize that with even first-line supervisors. And that's important to Southern Company culture. It was equally important, though, that we partnered with Fusion Health and even brought them up to speed on what is it like to work at Southern Company. So we talked with them and spent specific time talking about what the Southern Company culture is all about, what our values are, what's important to us. And that was for the entire staff of Fusion Health. So from care managers to IT to fulfillment, everybody kind of got a deep dive into what's Southern all about. And it's that kind of attention to detail that I think positions a program like this to be most successful. Looking at the next slide then, beyond launch, when we think about, okay, we're ready to launch and make contact with employees, we leverage the typical vehicles such as emails and targeted mailers to homes and things of that sort. I think probably what we're most proud of, though, is the partnership that we established with a well-integrated well-being team. So at Southern Company, we focus on a culture of wellness where we focus on the whole person, and we've got teams out in the different business units. And to be able to link those teams to the program, to Sleep Charge, and the wellness portal that we used became a natural place to then interact with the employees. And that was very, very important. Flipping to the next slide then, when we look at the actual experience, we've talked about awareness. We've talked about the Southern Lifestyle Integration, which is where kind of the intake, where employees would naturally go to report wellness behaviors, and right there is where we positioned Sleep Charge. We found the takeaway was that leveraging this program, we were able to provide quicker, more efficient model that drives the therapy, adherence, and sustainable results. Jonathan mentioned that. We shortened the time frame from start to finish to be able to get the care to the individual. So from awareness to the sleep check to the personalized sleep guidance, leveraging technology, even having care managers provide life support, those were the things that were the differential. And after 2 years, almost 2 years of the Sleep Charge program, over 35% of our workforce has engaged and completed their sleep checkup. Additionally, approximately 40% of those estimated to have a sleep disorder have received care and joined the Sleep Charge program. And we're really excited and proud of that. So if you move to the next slide, as I mentioned, not only did we want to make a big splash initially, but we wanted to keep this momentum going. So it was important that even after launch, we kept this front and center for our employees. And we used health fairs, biometric screenings, featured education, whether it was online or in print. We even used People Like Me videos where employees can see their colleagues achieving results through this program. And as you look for those sustained results, that was going to be important for us. And so Sleep Charge continues to be a part of our campaign to help our employees live their healthiest lives and to really focus on total well-being. If you go to the next slide, within Southern Company, it's important to us to certainly be inclusive. And so we provided access to all employees and dependents. So they're all eligible to take the sleep checkup to obtain the personalized information about their sleep quality, which is known as their DTQ, duration, timing, and quality. Education is provided via the Southern Company website, And Sleep Charge provides medical and cognitive behavioral therapy to members as needed. It really is a focus on the total well-being, which is important to us. And then the last slide, this is really what members are saying. This is what they're thinking. So here are some things that we hear from employees. And for us, while numbers are important and we've got to track that, it really is about our people. So the Sleep Charge teams, focus not only on good health, but on the overall person and the quality of sleep. And Sleep Charge is really not just a sleep apnea program, but a growing center of excellence for sleep. And with that, I'll hand things over to John Leiter.
Great. Thank you, George. And Jonathan, hopefully everyone can hear me okay. I will bring us home very quickly to give you all just a very quick background about who we are as a company and what we provide. And if you'll go to the next slide, I can close this out here. Fusion Health and the Sleep Charge program effectively is, as we call it, a center of excellence for sleep. Our mission each and every day is to provide healthy sleep for all. To do that, we've believed and have put in place what we believe to be a comprehensive solution. As George had spoken about the pathway, the participant experience, it's important to note that we want everyone to engage in a conversation about their sleep. Those that have occasional sleep problems, we want them to be able to have education and resources and someone to talk to solve those. And even folks that have maybe disorder-based issues with sleep, regardless of what it is, we want to be able to provide them clinical expertise and outcomes. So we believe that we engage in populations, a conversation about sleep, and provide them with comprehensive solutions that include really the third bullet point, and it's the human being. It's not just digital healthcare. It's providing professional expertise from clinicians and behavioral experts and physicians to provide people with their outcomes. We believe that our solution is scaled and consistent. That simply means that if you're in Albuquerque or you're in Boston, you are receiving the same protocol-driven care and consistency of care and consistency in price of that care. Our care managers, our back-end, our behavioral specialists are there to help people get through the tough times of therapies, but also stay on their therapy and receive the results that they need, their quality of life changes that truly provide outcomes. And then, as Jonathan showed, downstream outcomes for our clients. We have a value-based fee structure, as Jonathan had mentioned. We believe that we provide value when we initiate care. Therefore, we have a bundled charge that exists when someone joins what we call a participant into our program. And if it's a chronic condition that we're treating and caring for, at their renewal, if they choose to continue participation, they're provided with, we run through the claims wire, another charge for what we call care cycles, which is 12 months of care. So we believe in a value-based fee structure. And then ultimately, it's about the data. And if you focus on the participant themselves and some of the great things that George had shown regarding some feedback from people, we believe in focusing on the participant and their needs and their health and an overall conversation about their health through their sleep. We can provide results and reporting back to our clients at different intervals to ensure that it's meeting the needs of our participants first and the clients that hire us to perform a center of excellence for sleep solution for their employees. So I think with that, Shiloh, I will hand it over to you for any Q&A.
Thank you so much. And just a quick reminder, please do feel free to ask questions through that Q&A box. I'll go ahead and get started with some of the questions that folks have already submitted. So this is a question for the Southern Company folks on the line. What was the primary reason that you chose Sleep Charge by Fusion Health for your sleep solution versus other vendors?
So I would say if you roll back up to about slide 10 or 11, there's really kind of 5 primary reasons. You should go forward a couple of slides. There's really about 5 reasons why we selected Fusion Health. We go through about 2 more slides. Really, they addressed a lot of the issues that we saw in the care continuum. Instead of it taking 10 years to get diagnosed, you could be diagnosed, as quickly as in 18 hours. They can start treatment within 5 days, not months. And so it really compressed that time frame. They have different avenues to get tested, whether it's in-home, off-site, or if you have a specific condition, you can do it in a lab. So it was something that we could roll out not just to our regulated population, but also our non-regulated population. As John mentioned, they have a bundled payment solution. And so the biggest advantage we saw on the front end is that you got to do the sleep testing. There was no charge for it unless you actually stepped into treatment. So that allowed us not only to reduce our costs from a company perspective there, but there's no commitment on the employee's perspective until they step into treatment. So there's no expense. So there's really no reason not to take those steps if you've identified you need support. We also really love their technology and thinking through that. There's a full data loop back to where you're getting the adherence data on how well you're sleeping at night, how your apnea was going. And so you have that and the personalized touch, as John mentioned. But really looking at Fusion Health and seeing, okay, they started out as addressing certain sleep medical solutions. They moved into growing into much larger companies, so they can be our one source for sleep care management and sleep health. And so it allows us to send it to a large population that if you have a sleep issue or want to learn more about sleep, you have one place to go versus 3 or 4 different doctors and recommendations. So you're getting consistency and quality care from them. So those are the main reasons why we took Fusion.
Thank you. And just following up on that question, another one came in. For the bundled payments, how do you decide on pricing that's attractive to employers? So for example, how do you manage the resupply of CPAP equipment to keep costs within a reasonable range?
You want me to take that one, Jonathan?
Yeah, John, I think that one's for you.
Sure. Yeah, so our bundled, so let me just go back to the idea of value-based care as we see it is providing outcomes for the participant. So we typically see during people's therapies that they have changes. So someone that's on PAP therapy for obstructive sleep apnea that's lost a significant amount of weight may need a different mask. The technology allows us to see those things before they become broader issues. So what we do is we provide medical care and clinical care under a medical services fee that incorporates those things. So we don't charge fee-for-service claims for a new mask or a new hose. We provide those as part of people's therapy, and each person is different. So the idea is to have them be successful on their therapy. So we provide that in what we call a dynamic manner. So that's sort of how we provide our bundle pricing. In terms of what it means to the employer in making these decisions, I think Jonathan can speak to what it's meant to Southern Company as you compare us to someone that's going through the current system or the traditional healthcare system. So Jonathan, do you want to add anything?
Yeah, so the best example I would use is we were down at Gulf Tower probably 3 months after we rolled this program out for a health fair, and one of the employees came up to me with a letter, and it was from their spouse, and the spouse said, "Thank you so much for implementing Sleep Charge program. My spouse started treatment, and they no longer snore, and I now have gotten the best night's sleep I've had in over 20 years." And so to see not only the employee get the impact of, hey, they're sleeping better, they're more productive at work, you're permeating that into the household. And so you're reaching people that you didn't really impact. So it's just been amazing to see how many testimonials that we've seen. And our culture is very much a word of mouth culture. They will let their business partner or their colleague go through something and experience it before they do. And so to have that positive feedback come back and say, hey, we've had some good experiences, it's changing my life, you should check it out, at least evaluate whether you have any sleep issues. It's been able to really impact it, and the word of mouth has spread. And I think that's why we've seen, 35% of our entire employee base at least take that first step and look at the risk assessment.
Thank you for that. And just another quick payment question. So what is the billing model for your employees? So how do they pay for this, or do they pay for this?
We do have a cost share for the employees. The way we structured it is understanding the Fusion Health's bundle charge for their services. They use a specific procedure code to build that bundled solution, and then we essentially evaluated what were they paying through the traditional cycle. So it is X number of dollars more than what Fusion charged, and then what were they paying out of pocket for these same services for testing, diagnosis, and treatment. And so looking at that, we used the savings in the difference between the bundled solution and the traditional avenue, and basically created a cost share that would reduce the employee's cost either by a flat copay or a reasonable co-insurance percentage, but also was still a savings to the company.
Great. I have another question. What is the process for implementation? How long does it take, and how are the companies supported?
Jonathan, I guess you want me to take that?
Yeah, you want to take that one?
Sure, and then you can add on. So implementation really falls in line with, from a basic standpoint, with what George was saying at pre-launch. As we're doing this, we scope with our clients the entire process, start to finish, where they want to be, where they want us, what does their culture look like, and that's part of it, right? It's also the mechanisms for the health plan and the integration, as Jonathan talked about, and connecting in with the insurance company, the third-party administrator from the self-insured employer, really start to finish in what I'm very proud of our folks about is sort of scoping the entire implementation from start to finish, so that we make things easier for the employers. We want our clients to be able to allow us to have that connection with their employees, their health plan members, and we take it from there and provide that support for them, run through claims processing, billing, all of those good things. But that's sort of the implementation process of starting with our clients. There's a lot of work that goes in it. And it's soup to nuts, very specific, customized as necessary to meet the culture of our clients. But it's a very robust process.
Yeah, John, and I would add to that from the the client perspective, Fusion is one of the few business partners that we've worked with that he hit on that culture. They really take the opportunity during the implementation process to learn the company culture. We actually went up to Fusion and sat down with their entire team and talked through about Southern Company, what are our core values, this is the mindset of our employees, so they could develop a communication strategy from sitting in that seat of those linemen or those engineers and making sure that we're developing messaging that meets them where they are and gets them engaged in the process sooner rather than later.
Thank you. And just another quick reminder, I still do have a few more questions to get through, but please do type them into that Q&A box if you have any other questions that we have not covered already. So the next couple of questions are, what other sleep issues do you treat beyond sleep apnea? And how, when or why did you expand into providing insomnia support?
Sure. I'll handle that from my aspect, and Jonathan can certainly provide any color here. But we started in the business of treating obstructive sleep apnea. And we've learned as we've expanded our business that really we've had participants and clients alike that have come to us and said, can you help me with this? Can you help me with that? So that's why we've expanded to this Center of Excellence concept of being able to provide people with treatments for sleep disordered breathing issues, which, by the way, is, and I won't get into the technicalities of it, not just obstructive sleep apnea as we know it, but those that suffer from different types of insomnias and the pathways that they can take. We've also worked with people with restless leg syndrome or circadian rhythm disorders. There are obvious issues with sleep disorders that certain sleep disorders that take continuous ongoing care. And in those circumstances, narcolepsy is an example. Someone requires in-person physician management on a typical basis. What we do in those circumstances is we will work to get that participant with that issue to an American Academy of Sleep Medicine boarded physician, approved physician within their marketplace to get that care that they need. And then we're there to provide them with those answers beyond what is just typical sleep apnea. So hopefully our expansion into cognitive behavioral therapy for insomnia was something that was really born out of the needs from our clients and our participants. There are other things that we have on our roadmap to expand to, but really handling sleep disordered breathing and insomnias and restlessness and circadian rhythm disorders, which takes on many different genres or many different formats, you know, for people that have shift work disorder, to people that have jet lag disorders, things like that. It's about providing them education and resources and outcomes for those sleep issues.
Thank you. And just piggybacking off of that, so does Sleep Charge have any sort of personal care? Meaning, is it, and I think you sort of got into this a little bit, is it just an app, or can you actually speak to physicians? Is it more of a navigation service? Can you talk just a little bit more about that?
Yeah, the answer is yes to all the above. There are people behind the technology. It's not just a mobile platform or a web-based platform. It is very much meeting people where they are, as Jonathan had mentioned early on, where we have behavioral experts, social workers, people that understand and are educated in behavioral backgrounds to provide people with behavioral solutions. Additionally, all clinical decisions are made through telehealth through board certified sleep physicians. So any medical diagnosis that runs through our program is backed by board certified sleep physicians that are there to answer questions, provide diagnoses, provide teleconsult, things of that nature for people as they deem necessary. If it's as simple as someone wanting to just chat us, That's great. If someone needs to speak to us on the phone, we're there for them. If someone needs to have a teleconsult, we can have a teleconsult with them. So we really are focused on using technology to deliver professional human support.
And John, this is George. I would add to that. I know I've heard lots of employees talk about the fact that there's outbound calls from Fusion. So when somebody starts receiving treatment, there's a coach that checks in and says, "Hey, how are things going? How's your mask fitting? Oh, it's not fitting well. Let's talk about that." And I've heard very positive things about, "Hey, I feel like that I've got a partner," because being on a CPAP machine can be very challenging, can be very frustrating, and so it's nice to know that you've got somebody there to kind of walk you through the process and really coach you up. And I think that's been an important experience for employees.
Yeah, and I appreciate that. It's just one more thing, as George, you had mentioned the on-site visits and the after launch ongoing. That's really where we got, and if I haven't said this before, that's really where we were told the things that we needed to expand to. People coming to us and saying, I'm sleeping great, but my husband, my wife, my significant other, my partner isn't. Can you help? So that's really where the professional side meets with the technology. We leverage a lot of data mining through clinical algorithms to let us know that an issue is happening before it becomes a long-term problem for someone. And so we're able to sort of navigate people and guide. And I guess the answer to the question, simply put, Shiloh, is that we are a little bit of everything. We are a mobile platform, a web-based platform. We are in-person professional support, clinical backed, and care management. But we really leverage technology to meet people where they are.
Thank you. That is a great answer. I think we've exhausted the questions from the audience. And again, please feel free if you have any other quick questions that you want us to get through in these last few minutes. First, I just want to thank all of you for taking the time today. I think this was really great to learn about the Sleep Charge program. I have a couple quick final notes before we close for the afternoon. First, just wanted to give everyone on the line a very brief reminder about the Business Health Agenda BHA 2019. Registration is now open. Early bird did end on Monday, but registration is still open. Please feel free to go to the website, go to the events page, and you'll find it there, or use this link. Also, please do fill out an evaluation for this webinar. Please check your browser once this webinar is complete. This will be used to help us improve and plan future webinars. And with that, I think we'll adjourn for this afternoon. Thank you so much again, Jonathan, John, and George. And have a great afternoon, everyone.
Thank you all.